order. Thank you everyone for your patience as we've addressed our issues. First item is the approval of the agenda, and members, if you will refresh your agenda, the new order will be in front of you. We're going to move Lifeway's monthly report and resolution up to item C, so as to accommodate Commissioner Snell's schedule. In addition, we are adding item K, a report from the Veterans Department. Chair will entertain a motion to approve the agenda as noted in your board docs.
So moved. Forward.
Thank you, Commissioner Snell and Commissioner Williams. Any questions? All in favor of the agenda as moved, please say aye.
Aye.
Aye. Any opposed? Thank you. Appears to pass. We are up to public comment. This is a 3-minute public comment. If you have public comment, please approach the podium. Any public comment? Thank you, ladies and gentlemen, for no public comment. Okay, I'm sorry, but Commissioner Snell has to leave. We're up to committee items. First is the minutes from last month's meeting. Chair will entertain a motion to adopt.
So moved. Forward.
Thank you, Commissioner Snell. Thank you, Commissioner Williams. Any questions or comments? All in favor will please say aye. Aye. Any opposed? Appears to pass. Thank you. We are up to appointments of this committee. You'll notice, members, that we have some applicants, thank goodness, for the Department on Aging Advisory Council. There are 5 applicants, including some who have been members. Chair will entertain the pleasure of the committee. Thank you. I hear a motion to recommend to the full board the appointment of the 5 applicants. We have support. Any questions? All in favor of those 5 applicants going forward to the full board will please say aye. 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 Any opposed? Thank you. We're now up to Lifeways, and Director Mary Beth Leonard is here, and also there is a resolution that will be an item for action today. Welcome, Madam Director.
Good afternoon, Commissioners. So I do want to cover, in your packet, you'll see this month's report. Really, the things that I wanted to point out relative to the report is that Lifeways this summer had a strategic planning summit with the board, and part of that work was seeking input from our stakeholders around our strategic plan for the next 3 years. You'll see included in the report are the highlights relative to the 5 goal areas, which really resolve around better health, better care, better outcomes, lower cost, and equity. So those are the areas. I do want to kind of point out a couple of things that the agency is really going to be focused on over the next 3 years, really aligning ourselves so that when we are done with the federal grant for the Certified Community Behavioral Health Clinic, that we are prepared to be a part of the state's demonstration expansion that will occur in 2 years. So meeting the requirements to be able to do that, which allows for additional funding. And really the most important thing to know relative to the Certified Community Behavioral Health Clinic is that it allows us to serve all in the community. So it's a really great opportunity. We will also be looking at opportunities to expand and evaluate the efficacy of putting into play a crisis stabilization as part of our crisis continuum. So that is another area of focus over the next couple of years. We also need to ensure that we're doing everything we can to reduce costs. So in the event that part privatization does occur in the state of Michigan, that we are prepared to be able to demonstrate that we can provide our costs lower than competitors. So you'll see that included in the plan, and you'll also see better equity, and that really is a focus on ensuring that our infrastructure as an organization really does provide for diversity, equity, and inclusion across all for our community and for our staff. Those are the focus areas. Since we met last time, one of the things that that's included in your packet is just a reminder that we're working both with the city and the sheriff office around sending staff to the CIT training, which will allow us to develop a co-response model for those in the community, and we're really excited about that. There were a couple of hiccups relative to training requirements that we learned about after the fact. They keep changing the requirements, and that's outside of Lifeways. It's the organization that provides the CIT training. So if you hear that there were some frustration from the sheriff's office, do understand that that really is not on Lifeways' part. That really is the CIT training organization and their requirements. But we are moving that forward, and we're excited about that partnership. And with that, that is it for my report. You also have included in the packet is the resolution that I presented at the study session. And at this point, I would like to request that the committee take a vote on the resolution.
Questions for the director as to her report? And Chair will entertain a motion with respect to the resolution. I hear a motion. Is there support?
I did not hear the motion. Would you repeat that?
I'll repeat the motion. The motion is to recommend to the full board the adoption of the resolution.
Support.
We have motion and support. Any questions?
Question.
Commissioner Williams.
My only question, I guess, is really for administration. Would we receive any financial gain or loss if we were to move forward with the privatization?
Did you say if we moved forward with privatization?
Yes. If we were to be for this.
From my perspective, that would be yet to be determined. It's too soon for me to say one way or the other on that. This is just a resolution saying we're not in support of privatization.
Right, I understand that, but I was curious if we had any information on what the financial impact of this would be.
Mary Beth, you want to take a shot at
Yeah, I think at this point in time, there's not enough information to know whether or not we would be financially harmed relative to these Senate bills. There just isn't enough right at this point in time to be able to answer that question.
Okay. Nothing further.
Further questions? Commissioner Snell.
Thank you, Mr. Chair. It's my understanding that if the Senate bills pass, then the oversight of this committee is eliminated. Would that be true?
That is absolutely true. If you look at the language in the bill over a period of time, it would be removed. That is absolutely correct.
Any further questions? Question is on the recommendation of the resolution to the full board for adoption. All in favor will please say aye. Aye. Any opposed will say nay. Nay. Resolution passes. Yes.
I'd like the record to reflect that I wanted to abstain from this vote until further study.
Okay. Let's see. We'll stand at ease for just a moment. please. Commissioner Williams, if you would give us a view on your reason for abstention, please.
Chair, so I've been doing some homework on this, and I guess just in short, I just would like to do more homework before voting yea or nay.
Okay, thank you. So what I heard was 2 yeas, 1 abstention, and 1 nay. I think that is not a majority of this committee. There's only 4 votes. We only have 2. You're going to prepare to vote, Mr. Chair? With a recommendation for approval. With the vote of the chair, it appears to go forward. Thank you. Anything more?
No.
Beth? Thank you.
Thank you. Thank you.
Okay, next item is Michigan Works Southeast update. Commissioner Snell, I think we're done with action items. Thank you for being here today, sir.
Thank you, Mr. Chair. I appreciate it.
Good afternoon.
Welcome.
Thank you. My name is Angela Watkins. I'm the Service Center Manager at Michigan Works Southeast. A little bit about us. Our mission is to develop today's workforce and tomorrow's economy by engaging employers, job seekers, and partners. Our vision is a community which fosters and sustains a strong, diverse economy where all people can live, work, and prosper. And we do that by creating connections to a better future. Our office is still open. We're open Monday through Friday, 8 to 5, but we're also serving our customers virtually if they need that service. Our message to the community is that there's over 8,000 jobs available in the region. We have 5 areas. And you don't have to look for your next career on your own. Please contact the team and we can connect you to a free training or job search assistance. Some of the things that we've been doing in the community, we've been partnering with Michigan Advocacy Program, and actually this Wednesday we'll be doing an expungement fair. We've had over 82 people register and apply for an expungement. They've screened the applications, and so far we have 19 people that are scheduled. Normally an expungement fair is just open to the public, but we decided we wanted to make sure that the individuals that did show up, that they truly could get their offense expunged. So all the applications were reviewed, and so far 19 people are available. So we'll be doing that this Wednesday from 10 till probably 2:30 or 5 o'clock when we finish with the last person. But these individuals have been contacted and they have an appointment and they will go through the expungement process. This year, the police station will actually be coming to Michigan Works doing the fingerprinting on site. And we're actually pulling the court, the official court records beforehand, and we'll have them in the office. So once the person's at the center, they don't need to leave. Everything will be there, and the attorneys will leave with their application. We're also partnering with Access for All. They're a pre-apprenticeship readiness program. We've attended 2 recruitment and job fairs with them this summer. We also partnered with Consumer Energy on a Summer Youth Energy Academy. There were 12 high school students. They attended a 6-week program. Part of the program was based on energy, and the other part which we covered were the job readiness skills. We've also been collaborating with Catholic Charities, Andy's Place, and the Interfaith Shelter, providing information about the services that we offer in the community. I'll now turn it over to Tom Robinson, our business management.
Thank you, Angela. Commissioners, thank you for having us here today. Mr. Overton, I think you said there was a mouse up here. Is that what you're indicating?
Oh, I'm sorry.
I'm not sure if I'm seeing the mouse move.
You're right there.
Where's that? Sir. I'm just not seeing it move here. Okay, perfect. You are on my slide. So thank you for having us here today. My name's Tom Robinson. I'm the Business Service Manager for Michigan Works Southeast for all 5 counties, including Jackson County. First off, it's a pleasure watching you do business here today. I served 8 years on Livonia City Council, and I almost raised my hand for an interview. So, but I promised my wife I wouldn't do that no more. But since the last time we were here, I want to give you an update on what we have accomplished in on the business services team. The biggest item that we have going right now is the annual Going Pro Talent Fund application season that we've been going through. I think the last time we were here, I gave you some of the numbers on the information sessions that were attended, and I have some updated data. So when we did the info sessions, we had 115 people attend the information sessions or organizations. We had 113 one-on-one meetings completed where we meet with a business or an organization and talk to them about Going Pro and help them do the application process. We submitted 33 applications here in Jackson County. Overall, we had 106 total applications submitted, which is one of our largest years yet. We had 17 Jackson County employers apply for $1.4 million, and our overall applications were just over $5 million. So we are waiting for the approval on those or the awards to be announced for those grants here this week still. So by the end of the week, we hope to know what companies here, both in Jackson and the other 4 counties, were approved for Going Pro Talent Fund grants. Next slide, please. Some of the other activities that we've done is Employer of the Day events. We are doing back to face-to-face events in our centers. We've done 12 companies or organizations so far in the last quarter. We also have done incumbent worker training grants. We've done 4 of those here in Jackson County for a total of 23 trainees in the last quarter. And currently there are 1,596 active job postings on My Talent here in Jackson County. So this is normally a slide that Shamar or Misty would cover, but I'm pleased to do it for you here today. Michigan Works Southeast is a resource for Jackson County. We have 2 sides of our services, on the business services side and the job seeker side. On the business services side, we do on-the-job training, incumbent worker training, Going Pro Talent Fund grants, foundational HR assistance, recruitment, corporate assistance, and EDSI solutions, which is helping turn around businesses that are struggling. So we'll do an IWT grant to help train the leadership team in an organization to turn around their organization. And on the job seeker services side, we have training opportunities in classroom and on the job, career and coaching and labor market info that we can provide, paid work experiences, apprenticeships, and adult education services. I think this is Shamar's favorite slide. He asked us to repeat it again today, and how you can help get to know us. Again, my name's Tom Robinson. I'm the Business Service Manager. I think I'm becoming familiar with the names and faces here today, so thank you for that. This is Angela Watkins, the Service Center Manager. Set up some time. Please come and visit us. Connect with businesses in need and refer them to us, please. Send job seekers our way. Be an advocate for Michigan Works. Reach out with any workforce questions that you have. Our contact information will be on the next slide here. And know that we are more than a workforce agency. We are a connector, so making connections to a better future. With that, if you have any questions of Angela and myself, we're here to answer them.
Questions? Commissioner Williams, and then we'll do Commissioner Bear.
I don't have a question, but I do have a comment. I just wanted to express my sincere thanks to the both of you for your work and what you've done with Michigan Works. I've counted it as a privilege and an honor to be able to work alongside you as a member of the consortium board. And also just wanted to say thank you to your office, and if you could also send these regards to Shamar as well, just for sending the beautiful flower bouquet to the service of my father at my father's passing. My mother found them to be very, very beautiful, and she really appreciated it as well. So just wanted to say thank you for thinking of me in my time of bereavement.
Thank you. We have a meeting with them this afternoon. We will pass that along.
Commissioner Bear, please.
Good afternoon. Angela had mentioned your expungement program. Do your clients need legal representation for that, and do you provide it?
Michigan Legal Services out of Washtenaw County will be providing that service.
Okay, thank you.
6 attorneys coming down for the expungement fair. And they'll be actually filling out the application for the expungement with each participant.
Okay, so legal consultation they need will be provided.
Yes, it is.
Thank you.
Thank you.
I think about the number of jobs you have on your list, almost 1,600. That,
Yes.
if I do the math right, that's 1% of our entire county's population, from infants to senior citizens. That's a lot of jobs. I think we're in a unique situation right now where there are so many jobs chasing so few, apparently, people willing to take them. What's your reaction to that observation? What are we doing? What more can we do, I guess?
Well, that's a $1 million question, right?
It is. There is, array of reasons why people are not applying, but definitely the obvious, the health risk. And then some say the pay, and then also they're not willing at that pay to put their health at risk.
So it's a real challenge for businesses out there, obviously. If you own or are part of a business, you don't need to look very far to see the challenges that businesses are having, right?
But please use the microphone so we can hear you. There you go. Thank you.
So it's a real challenge out there. So what we're doing, at least on the business service team here, is we're obviously helping businesses source talent by doing job fairs and employer of the day. But what we're really trying to do right now is understand and get them to understand that investing in their current staff by taking advantage of some of our training opportunities. So when you invest in your current staff, your retention rate goes up and you don't have to replace staff. So that's something that we can do immediately with businesses. We tell them, we will partner with you to source talent and to bring on new people, but we're really trying to spend time with them on investing training dollars into current staff. The other thing we're working on is, we'd like to put together a larger region-wide discussion on that topic, right? I'm working with some business leaders across the 5 counties to have a forum, maybe with some of you as guests, where we talk about what needs to change to raise that conversation about what we need to do to change the job market in the other direction.
Okay. Any more comments? Okay. Thanks for coming today. Appreciate the work. Press on.
Thank you, Commissioners.
Thank you.
Have a great day.
Next up is the Department of Health and Human Services, and I think I see Zoe Lyons here. Good to see you, Zoe.
Thank you. Thank you, Commissioners, for having me here today. I submitted a report, so I'll just go over it briefly and just make a couple additions to it. Our child care fund, so the budget for the upcoming year has been completed and approved at all levels, so we're set to go with that. For our children's services programs, gonna ironically start talking about staffing first thing. We have 42 allocated positions for children's protective services, and we currently have 9 vacancies. So that's close to 25% of our staff, of our positions are vacant. Because of COVID, I think our numbers have been lower, so we haven't felt it like we would have felt in past years, being so low staffed. But we, historically we have 2 panels, which means 2 rooms of interviews happening at the same time every hour all day. So we would have about 16 people coming in to interview for a position. And we had 3 people that were at our last set of interviews. So, and we have lots that don't show up or, just are not appropriate. So we are struggling, just like everyone else, to get the right applicants and any applicants, frankly. So, we're in the process also of dedicating 1 prevention worker. So prevention is a program that you'll probably be hearing more about due to the federal legislation around prevention. But this prevention work is something that's meant to really bring families in for support and resources prior to a Children's Protective Services complaint. So we want families who might be struggling to come to us early, and for us to be able to provide resources and support and education so that we never get to a point that there are allegations of child abuse and neglect that happens. So we will have one worker who will be dedicated to working with those families. Typically right now we get those families who come to us through community members, trusted advisors in the community who reach out to probably me specifically and say, I have a homeless family, I have a pregnant mom who's in need. Those types of families are the ones that we're tending to work with prevention. Our most challenging issues with families continue to be around housing, substance use, and domestic violence. Those are our top 3 reasons that we get involved with families. We do not have any vacancies in our foster care area, so we have 19 foster care workers allocated and a licensing team of 3 plus a supervisor. They've done really amazing work, and we've really been a leader in the state around our licensing work. And then I just list out some of the other types of positions that we have in our office, just so the commissioners are aware of what we have. I just wanted to share that Jackson County Children's Services at DHHS is really highly regarded in the state. So they reach out to us for support and feedback, and we participate on lots of statewide committees to help improve other counties who might be struggling. In our cash assistance programs, I just gave you some updates around cash assistance, food assistance, and Medicaid. Our participants in cash assistance are required to work, and we work with Michigan Works here, and our folks are now required to go in to participate unless there are specific circumstances that prevent them from doing so. With our food assistance programs, we've been under a waiver for a good amount of our time with COVID. That waiver ended in November, so now we are going month to month. What this means, and we did get approved for December, so what this means is that anybody who's approved for food assistance benefits will get the maximum benefit for their family size. So if you have a family of 4 and both parents work, their benefit for food assistance might only be $20 because of their income for work, but during this waiver, they will get the maximum benefit. So if the maximum benefit is $150 in food assistance, they will get that. And that is a way to help support our families through COVID. State emergency relief, that is where people come when they have shutoffs or other types of crisis situations. Payment caps for these increased from $950 to $1,150. And then effective this year, we can now provide energy assistance more than one time in a fiscal year. So we used to kind of tell people, wait until you have the highest need because you can only apply once, and that's not the case anymore. And then during this pandemic, we are keeping all Medicaid cases open, so Medicaid cases are not closing. We want people to be able to get the medical assistance that they might need, and so anybody who is approved for Medicaid, that stays open at this particular point. We continue to do race equity and DEI work at DHHS, so you've heard me say before that we're part of a state anti-racism transformation team. We have been funded to create a local Jackson anti-racism transformation team. We've been really excited to have over 350 members of our community, so that's both my staff and members of our community who have attended training around systemic racism, building relationships, and just really working together to try to do everything that we can. Jackson DHHS's work is really focused on the disproportionality of children of color in the child welfare system. So that is where we will focus our work. And then like all other DHHS offices in the state, we have our own DEI team. We come together twice a month to learn about how we can be more inclusive, and both in our office and our community. We have a positivity campaign going on, so one of our lobby navigators is just passing out notes to people who come in, and we gave you some examples there, things that say things like "you matter," "today is a new day," and we've really gotten some great feedback from that. You know, people come to our office for crisis, and not people going through things that aren't that great. And so to just get a little positivity seems to make a difference to them. And so that's, just wanted to share that with you. And then finally, I just wanted to mention that we have our Angel Tree program going on right now. Actually, families are coming to the office to pick up their Christmas gifts for their children. We have, this year, we've passed all other years, we are at almost 1,300 children in Jackson County who are getting Christmas gifts through our Angel Tree program. And that means that individuals, businesses, churches, they go out, they shop, they wrap gifts. Kids actually, it's a wish list, so they're getting what they are asking for, and then parents can come pick them up and have gifts for their children at Christmas. So, and then finally, I attached my community collaboration list. You see the things that we participate, not just myself, but my staff, that we participate in the community and also within our own department. So that's my report for this month, this quarter.
Any questions for Zoe? Commissioner Williams, please.
Hi, how are you?
Hi.
Just a couple of quick questions. As you know, children in foster care is something that is very near and dear to my heart. I was wondering if you could tell me how many children roughly do we have in foster care in Jackson County?
We actually have our lowest number of children in foster care currently. Our most recent report that came out said that we have 160.
Wow.
That's down from the highest I found since I've been here. I've been in Jackson for 8 years. The highest we were at was 342 at one point, and we're down to 160. So
that's pretty remarkable.
Yeah.
Congratulations to your staff on that.
Thank you.
And out of those 160 children, are they able to, I think you mentioned it, able to receive vaccination if they so desire?
Yes.
And
so as age appropriate, we are reaching out to parents and asking about getting vaccinations. So if the parents are sign and say they can get their vaccination, then the children are getting vaccinated.
Okay. Wonderful. I just wanted to make sure that they were at least given the opportunity to receive it if they so choose. Thank you. That's all I had.
Yes.
Thank you, and Zoe, just for members' knowledge, every time I've reached out to Zoe and her staff, they have been very responsive, and thank you for your ongoing work.
Yes, thank you so much.
Okay, thank you. And now on to the medical care facility. Destiny, good to see you today.
Good afternoon, Commissioners. Okay, so I have our quarterly report for you, and I'm just going to go through the financial section with you. So the financials for August showed a net loss of $197,000. However, this was better than budget by $68,000, as the facility had budgeted for a net loss of $265,000 for the month of August. Revenue was under budget by $56,000, but expenses were also under budget by $124,000. The census averaged 154, which was one bed better than the budget of 153. Now, this was a budget amendment that was made to go effective in August. Prior to that, the budgeted census had been 184. So I just wanted to draw that to your attention. So for September, September showed a net gain of $1,083,000, which was better than budget by $830,000, as the facility had budgeted for a net loss of $253,000 for the month of September. Revenue was better than budget by $979,000, and expenses were under budget by $104,000. The census averaged 155, which was 2 beds better than budget, with the census of 153.
That additional revenue was due to the employee retention credit, was it not?
That is correct, yes. Yep.
So that's a one-time sort of a thing.
So yeah, it was for 2 quarters of this year, and then it has since been suspended as part of the infrastructure package. For October, we did show a net gain of $358,000, which was better than budget by $506,000, as the facility had budgeted for a net loss of $277,000 for the month of October. Revenue was greater than budget by $506,000, and expenses were under budget by $129,000. The census averaged 155, which was 1 bed better than the budgeted census of 154. One of the things that I did want to draw attention to is you may notice that we had budgeted for a fairly significant loss in each of those months, and that's because we did not include the revenue that we would receive from the employee retention credit in the budget amendment because it wasn't a sure thing. So just to kind of give you an idea, year to date at the end of October, we had a net income of $3,291,906. So currently, we have cash on hand for 151 days, which I think is an important number for you as commissioners to be aware of. Our AR, or accounts receivable, is 47 days out on the return for that because of billing. Our goal is 40 days, but that is something that we have not seen in quite some time, so we're continuing to work on that. If you notice the census graphs that I've included, you'll notice that the census has started to stabilize a little bit more in this last quarter of the year, and so that was what caused us to decide to amend the budget to that census number of 154. As far as COVID-19, we have been considered to be in outbreak status since September 14th. So for us, outbreak status is any care partner or resident case. Prior to November 12th, that caused us to have to stop visitation. CMS from a federal level has changed that requirement, so although we continue to be considered in outbreak status, our families are now able to come to the facility and visit. So currently, since the beginning of the pandemic, we've had 86 residents that have tested positive and 103 care partners. We are seeing an uptick in care partner cases right now, but we have not seen any resident cases since September. So that is good. President Biden had made an announcement that all nursing home employees were to receive the vaccine. The details of that mandate was released November 5th. However, that mandate has now been put on hold due to a federal injunction. At this time, JCMCF is not moving forward with that until the injunction is off hold. The requirement was that all care partners would be required to get their first dose of the vaccine or the Johnson & Johnson vaccine by December 6th. So currently we still have about 50 care partners that are not vaccinated. We're continuing to provide education around that. We've reviewed exemption requests, but we are not moving forward with the enforcement of this until that is solved in the courts. As far as overall our people and workforce goes, we do have some outstanding grievances that we are working through with the different unions. We're also in wage negotiations right now. All of the unions have now negotiated their wages and they're doing their ratification votes, and that will be going before the DHHS board on December 20th at our next board meeting. And I think that is the majority of that information for you. We are still seeing an increase in mandatory overtime, and this is mainly due to an increase in call-ins for both nurses and CNAs. We're seeing a lot of variety in reasons, a lot of childcare issues. We're hearing from particularly our CNAs. So I did include that trend for you. We're going to be starting some new programs at the beginning of the year that we hope will help incentivize good attendance and help for those individuals that may be struggling with what we've all been taught is the proper work ethic, to give them some good motivation and positive reinforcement on how work should be done. As far as quality goes, we continue to be ranked as a 5-star facility. We have 5 stars in quality and 5 stars in staffing. We currently have 3 stars in our survey component of the 5-star staffing system. We are not able to increase that star rating until we have our next annual survey. So right now that's stuck at 3 stars. Our other quality measures are in good conditions. We were recognized by Newsweek magazine as the 4th ranked nursing home in the state of Michigan, which we're very excited about, and I know that's been shared with you, I think, a couple times now, because we're so excited about it. But we've also applied for the American Healthcare Association National Bronze Quality Award this year. And so that's a process that we'll be going through after the first of the year. And I think that is all that I have to report. Is there any questions I can answer for you?
Commissioner Bear, please, and then Commissioner Williams.
Are you and your staff county employees?
Counting employees in, county, yeah. Yes, we are, well, we are an enterprise fund of the county, so we are yes, but no. So we have separate contract rules, we have separate policies from the county themselves. However, we are part of different aspects of the county, which is a confusing answer.
I'm not sure I understand that. So you think you're exempt from county rules and policies and resolutions?
I can answer the question. They are not county employees. You're in the county pension system, but it's clearly separate. It has its own separate, funding mechanism and all that stuff. They're overfunded. We're on, well, actually, we're all funded correctly at the moment, thanks to the market. But technically, you're not county employees. They have a separate board. You operate. So you're no more an employee than a Lifeways employee would be. Though that means they don't follow our policies at all.
Do they receive funding from Jackson County?
They receive funding from a millage that the county board approved.
Well, that's the maintenance of effort millage.
Legally required
by
the state.
Yeah.
But it's...
Okay, I'm going to have to look into this further because we passed a county resolution that we would not be enforcing mandates. They're unconstitutional, just like the court has said. And if somehow this department that reports to us and receives money from us is getting around that resolution, then I'm going to have to dig into that and see what needs to be changed.
I think I heard Destiny say that they're not mandating. When you hear about mandations...
She said that the courts put an injunction on it, and that's why they're not mandating it.
Right.
So this mandate came from the Center for Medicare and Medicaid Services as a condition of funding through that program. And currently Medicaid and Medicare pays about $19 million to $20 million of the facility's budget. So we do have a little bit of a challenge with that, but being that we are considered an enterprise fund of the county and separate, I think that was the thought process in that, but I can understand your concern, Commissioner.
Okay. We got here what looks to me like a fragmented sentence. A temporary injunction granted nationwide on November 30. Oh, granted what? I mean, that's not a complete sentence.
I apologize. So there was a temporary injunction granted nationwide on the CMS mandate. This came out of the Louisiana courts, and it was granted on November 30th. It's still on hold. I think they're still in the process of hearing that case, but at this time it suspends any enforcement of that mandate or that policy coming from CMS. And at this time, we have decided that we don't want to move forward without that policy being in place or being a requirement from a federal government level.
Well, based on the court injunction, you can't move forward with it.
Right. Correct, unless we mandated it as a facility, which we do not want to do.
Okay.
And Commissioner Williams, please.
Is that better? There we go. Sorry, I didn't have my mic on. Sorry about that. Again, in August, if I'm reading your report correctly, there was a net loss, but in September and October, you're showing a net gain. Was that gain due to any federal credits given during that time?
Yes, so that net gain was almost exclusively the employee retention credits.
So if we did not receive those credits, would we have fallen in the red again?
yes, for those months. However, we have made some adjustments since that time in what we had budgeted for census and some of our expenses to try and offset that if those credits were to go away.
Okay. So when is the last, if you don't have this information in front of you, that's fine, but from your recollection, when is the last time the facility finished the quarter in the black?
I don't have that information off the top of my head, but I can find that out and I can email it to you if you'd like.
Okay. I think the best protocol calls to email it to the to administration, and then he'll send it out from there.
Absolutely, I can do that.
So I'm and this is not necessarily directed to you, but it just seems as if we continue to keep having the same conversation of concern of there being consecutive net losses since even my infancy of being a county commissioner. And I understand that the county government isn't necessarily in this business to make money. However, we need to be sure that we're making the best decisions with the county dollars that are sent to the facility. And my concern is if we continue with what we're doing, we're going to keep falling further and further into the red. And I appreciate that you mentioned that you're making some changes and you're trying to put the best pieces together to come out with a positive result. But I'm wondering if there needs to, if we need to have additional conversations or an audit performed or whatever the case might be, just to help us get closer to the black in that regard. So that I just have some very, some great concern as it relates to our expenditure here, because it's not that we're falling in the black by a couple $1,000, but in the red by a couple $1,000, but we're hundreds of thousands of dollars consecutively. And that's over time. That is a lot of money, and so we just want to make sure that we're doing what's necessary in that regard. And then you also stated, and this is just for my clarification, you stated that we had a round figure 150 days for cash on hand.
Yes.
Okay. At day 151 or 152, what do we do from there?
So that cash on hand figure is based off of if we had no revenue coming in whatsoever. So we would be able to stretch that 151 days much further than that, because we do continue to have revenue coming in. But that is part of what is going to continue to sustain us over time. And I do understand your concern about seeing the facility in the red month after month. And again, I want to draw attention to, even though the budget was budgeted for a net loss, we have actually seen gains because of those programs.
And I appreciate that.
And I understand that they're not an ongoing program, but part of my obligation is to find those programs as they become available so that we can continue to make the facility sustainable. But we know that as those programs begin to dry up, we have to get more and more creative.
Thank you. So finally, then, as we understand that any resolution passed by a county government doesn't necessarily direct or enforce any law, but just more or less states an opinion. But I do want to make sure that those in your care, if they are requesting a vaccination, if that is their choice, if they're requesting that, they do have the opportunity to receive that.
Yes, absolutely. I believe 93.7% of our residents are vaccinated.
Okay, that's good to hear. I do know that, and I'm a firm believer that masks and vaccinations or what have you should be by the choice of the person. I don't necessarily agree with it being a mandate, but I have had conversations with individuals, not necessarily related to county government, but just in other places where they felt like they were not given the appropriate time and or whatever was necessary to get the vaccination at their choice. But so to know that that's not a problem here is very encouraging. If there's anything that I can do, I'm certainly not a mathematician, but if there's anything that I can do in helping us come to a better end in our in a quarter, or in any quarter, if there's anything that I can do to help with that, please let me know.
Okay. Thank you.
And also, too, I appreciate what you're doing. You are in a very challenging position, and this isn't the first time that any county commissioner has expressed their concerns, but yet you come back with a report and you do your homework. You're doing what you can, and so I do want to say that I can see that, I appreciate that, and I hope you don't feel as if I or any other commissioner is kind of backing up against the wall and enforcing this great deal of pressure, because that's certainly not the case. We're here, we're standing with you, and again, I appreciate your strength and determination during this time, not just looking at the numbers, but yet going into this line of work and being a frontline worker in this pandemic. I just want to personally say thank you for everything that you've done.
Thank you, Commissioner.
Well, and Commissioner Williams' comments are really go to the requests that this committee has made to you and to your committee, your governing committee, about, what do we need to have in order to break the facility even, or come close enough to breaking the facility even, that we don't have to increase the millage for the maintenance of effort. I mean, that's the main thing, is that the county would have to do, realizing that you are the facility for many people of last resort, and we conduct this operation as a matter of grace to those of our society who stand in need of its services. And so we do have a millage in place, but if there comes a point where the maintenance of effort from the county is inadequate, we need to know that sooner than later. So I think I'm saying the same thing that Commissioner Williams said in a different way, but that's why we continue, and I will continue to press for knowing what's necessary to break us even, or at least to know whether we're running into a situation where we need to consider more what the county's involvement in the medical care facility should be.
Yes, and I fully understand your concern from an oversight perspective and needing to do that, so thank you.
Okay, anything more for the medical care facility? Commissioner Williams.
I'm sorry, I forgot on one additional question. In your report, did you mention anything about staff at all, in terms of are we fully staffed, understaffed?
I did not. We are not fully staffed.
Okay.
We have currently about 60 open positions. About 40 of those are in our nursing department. But part of that does have to do with the fact that our census is lower.
Oh, okay.
So, but we aren't able to increase our census because we don't have staff to be able to care for those residents. So it's kind of a circular effect. Particularly with our CNAs, that is where we're finding the most challenge. We do have some challenges with finding nurse candidates right now, but primarily we're seeing that with our CNA candidates. And that's a very tough job. It's very physically demanding, especially with the PPE that we're required to wear. Currently, because we've been in outbreak status, we're wearing N95s. So when you're assisting in moving a resident, turning and repositioning them, maybe helping them walk back and forth to the restroom, it's hard work to do in an N95. So.
Thank you, Mr. Chair. Nothing further.
Okay. Thank you, Destiny, for coming in today, and have a good Christmas.
Thank you. You as well.
And MSU Extension Memorandum of Agreement. Well, I guess this is an actual action item here, Mike. I missed this one. We don't have Ray here, but we'll see how it goes. There's 3 of us. Okay.
Good afternoon, Commissioners. This is our standard agreement that's been before you in the past related to our annual general fund budget allocation that you provide. Just outlines the services that Extension provides and what the county provides for that contractual budget agreement amount of $93,970. Be happy to answer any questions about it, just requesting it be moved on to the full board for approval.
Questions for MSU? And I guess I would ask the administration, is this consistent with our work plan and budget, Mike?
It is.
Mr. Chair, if there's no further question or discussion, I offer motion.
Commissioner Williams moves the adoption or the recommendation of the agreement to the full board. Is there support? Thank you, Commissioner Bear. Any more comments? All those in favor will please say aye. Aye. Any opposed? I count 3 votes in favor, and so it moves on to the full board.
Thank you very much.
Thank you.
Have a good day.
And now the Department on Aging. Danielle, you've been so very patient. Everyone's being very patient. Thank you for doing that today. We've had a long morning, and afternoon is starting to grow long, yes.
Good afternoon, and just to begin with the report, I just wanted to share that our van that we had requested for the Meals on Wheels program has arrived, and we're very excited for that. We're going to be putting in a request with the Facilities Department to put in for the auction of our 2006 van. That was purchased with Senior Millage Fund, so when that goes through auction, those dollars will go back into like our scrap metal line to account for the funds that were used to purchase that van. So our current vans, the oldest will be a 2014. So again, we're very excited to get that into play. Over time, that 2006 van had about $10,000 in repairs throughout those years. But if you kind of calculate that out, it's actually been a pretty affordable van. That's the one reason we kept it for so long and replaced other vehicles that may have been a little bit newer than that. We had an unexpected equipment need that came through in November. One of our 60-gallon Cleveland kettles had gone down. It was not able to be fixed. So we had an expense that came in around $24,921. We were able to go ahead and get that taken care of. We had money within the current budget to help absorb that cost. Again, that could be related to different supply items that were underspent and some staff positions that were not filled. So we were able to go ahead and get that taken care of. So that equipment piece is on order. We're in the process of planning for our 2022 Soups On for Seniors event. It'll be March 8th, and I'll continue to give you updates as we proceed towards that event. But I just bought a couple bowls in. We work with our seniors who paint bowls, so the picture that's on your report are some bowls that were painted by one of our seniors that comes into the Crouch Center, and they'll be put into the auction. She paints kind of a different bowl set each year, so we're always amazed with what Karen creates and wants to put into the auction. And we work with in the past, we've worked with nursing homes in painting some of the bowls. That's been a little bit more challenging this year. But we've also partnered with some of the different school districts. And so these bowls that I just wanted to bring in and show because I think they're so great. These were painted by Napoleon schools. And so their art class painted, I don't know, over 75 bowls for us. So we say on our information that we're going to give out at least 120 bowls. Sometimes we go up to 200. It just kind of depends on to the Friends Board. But the first 120 ticket buyers are guaranteed a bowl. Sometimes people buy bowls at the end of the night. And again, all those funds that the Friends of Jackson Seniors raises goes back into a donation that they'll generally make to our department. And I do believe that they'll continue to move forward and use that to purchase a van for the department. So
again, we're excited. We actually had our first call today for seats, and somebody wanted to buy a whole table of 8. So, we're proceeding and getting that event up and going. And I put on there a couple moments of excellence, and I think the first comment talks about the Meals on Wheels transporter, noticing something wrong with the senior. And so again, it's just that remembering with that service, it's not just the nutrition that we provide in the community, it's definitely that eyes on a senior, so that driver noticed that something wasn't quite right with the senior that they have gotten to know. And so they reported that to the office, and so then we're able to make that call out to the emergency contact and say, can you follow up and check with this person? We just noticed something was different. So again, with that person, they were able to get the help that they need. So again, the services that we provide, again, the nutrition is so important, but again, that daily contact for people that do not have people checking on them regularly, may not have close friends or family nearby, that we're able to, again, help support them. And does anybody have any questions?
Commissioner Williams, please.
First and foremost, I just wanted to just share with you that over these past few years I've been in office, I've gotten to know a lot of your staff and several members in my several of my constituents receive services, and they all have had nothing but good things to say about the staff and the services they receive. So I just want to say thank you for what you do. My only question I guess I have relates back to a purchase that we made some time ago about the trays and things. I was just wondering how we were doing in the midst of the pandemic, and I know we saw a little bit of an increase in service there, so I was just curious as to how we were coming along with that.
We're planning ahead for a request to come to the board, so we kind of took inventory on where we're at. We'll probably be coming back to the Human Services probably in February with a request to look at purchasing those items again.
Okay.
So we're keeping tabs on our supply, and we notice with the increase we're going through it a lot quicker. But again, we're making sure that we'll come to you for that request again.
Okay. Thank you. Nothing further, Mr. Chair.
Okay. Thanks, Danielle. Appreciate the work.
Wouldn't
mind buying a bowl or doing something here if we can we'll stay in touch.
Okay. All right. Thank you.
And now up to the Health Department. I think I see Kristen. Good to see you, Kristen. The audience is thinning.
And I don't have fun show and tell like Danielle does. She always brings fun things like an Afghan and bowls. I just bring me. So, the first item for the Health Department is a request to add an EMR, electronic medical record, to our MIP program, which is Maternal Infant and Health Program. In the interest of time and to keep things brief, most of the information is included with in your board docs, with the contracts being there, the staff report. One thing to note about this program, or this EMR that we're requesting, we've previously been doing things kind of in a hybrid model of our own, where we where the nurses and social workers enter the information in the hybrid model with writing and some electronics, but it's not a system like this. This is a system that I think there's 45 other MIP programs that do this program, or that have used, or excuse me, 45% of MIPs use the EMR, and then around the state there's a bunch of other ones who use this. What we anticipate to happen with this is some increased efficiencies, less errors because of the accuracy in reporting and putting information into a system that's designed for the MIP program. The annual cost, first there's a startup fee of $1,074, and then the annual cost is just under $7,000. So we've had it vetted by our finance office, and they, the MIP program itself has money to cover that. One thing to note too about the cost though, because of the efficiencies that it'll create, it's estimated to pay for itself in about a year and a half with, there's a cost analysis on here done by Jonathan, our finance person, who because we'll be able to bill for more services through Medicaid. Eventually, within about a year and a half, we'll be able to pay for it itself. The last page on there is 3 quotes that he received. The Epic is a little less money per year, but it will cost more likely in the long run because every change that we make has a cost associated with that. Additionally, with the electronic medical record, there's a third-party payer system, so it'll automatically bill Medicaid for all of those services that we provide there. So we're just asking for approval of that.
So a chair will entertain a motion on this, and then I have a question for administration. Commissioner Williams moves the adoption of the recommendation, and I hear support from Commissioner Bear. This seems like a relatively small potatoes sort of a thing. Mike, is there a particular reason we have to approve this here?
No, it's actually, I'm sorry, it's an ongoing contract.
The cost is
length of the contract.
Yes.
The length?
Yes.
The financial portion we could approve, but because of the length of the contract, it has to come to you.
I just wanted to make sure I understand it seems like the dollars are kind of small. That's why I wanted to think about, I don't want to get us involved in nickels and dimes here, okay?
Yeah, no, it's not the cost.
Okay, it's the length of the contract.
Is covered, but yeah, the contract, because it's not a set contract, but it just is the ongoing.
Very good. That's the answer then. Any further questions about the motion? Okay, all in favor will please say aye. Aye. Any opposed? Thank you, it passes. And that'll move to the full board. Okay?
So the next item is just on my regular monthly agenda. There's not a whole lot extra to report on here. The front page or the separate page on there kind of points out some highlights. We are doing boosters for all ages from 5 up through 105 or however old. The clinic is just staying very busy. We've done 2 immunization clinics at the schools. East Jackson and Vandercook Lake both asked us to come in, and so the nurses went over there and did 2 clinics there. Our health resource advocates that you approved a few months ago, they are working now. We immersed them very fully into orientation and learning all things COVID. And I was out at a training last week, but I received a notice, an email about how great they're doing at trying to make connections and the ideas that they have as far as how to get into the schools and see what the schools need. But they're still, like I said, they started on, I think, the week of Thanksgiving, and that first 3 days was all things COVID, and they've continued to do all things COVID. So most of the rest of the report, is general information. If there's any questions, I can answer it, but I won't go over them all. We are almost fully staffed, which is great because it's been a long time coming. I think there's just a couple openings left right now, and one was due to a recent resignation. Of note, in the environmental health department, though, is something coming to you that'll come to you next month. We have to update the soil erosion ordinance, so that has been vetted and gone through the EGO process and what they require as changes for our soil erosion process, so that'll be coming to you next month. And then I actually worked on it previously, but an Elbro Creek restoration grant project for E. coli, they're going for that again this year. So we'll see if it happens. I think we were denied about 9 months ago when I worked on it, and now they're going through it again with some Jackson County Health Department match, but only in kind. So, any questions about? I've glossed over a lot, but.
Commissioner Williams, please.
Thank you. Just a couple of quick questions. I was curious if if anyone from Jackson High School approached you to do a clinic at their school, or if you approached them at all?
I don't know for sure. Anyone that has approached us, we have the availability, we have the staff and the ability to do it. So I know that's how Matthew Budd, the Director of Personal and Preventive Health Services, would be the one who would handle that. So I wasn't specifically, but I know we're not turning, I know we have staff available to do that. That's how we got in with the Jackson schools, so, or with the East Jackson and Vandercook. So I'm not sure. I can check on it. Do you know someone that was, or were they looking for it? Had you heard, or?
I've heard some scuttle about it. It's a small conversation, but it didn't seem like they...
I know Matthew meets and talks with the school districts very, very regularly.
Okay.
So,
so if they want to do it,
yes, if they wanted to do it,
good.
I don't think they'd have any trouble finding who to talk to. He meets with the superintendents and is pretty on a first-name basis with all of the school superintendents. So.
Okay. And then my last question is, I have received several requests from community organizations as well as churches, mainly churches, that would like to have someone of the professional field, the health professional field, to come to their church and explain to them, how the vaccine works, explain the difference between, COVID and coronavirus, and just all those different pieces, just so that people can get the best education possible. Do you know of anyone within the health department that kind of facilitates that kind of a role, or that would be willing to?
You can direct them to my attention, and then I can definitely answer, and we can see if we could, work with them. We're definitely willing. Matthew, again, is probably, or someone from his team. He's got some great nurses who are right on the front line and working with the schools and that kind of thing. They can spout off, that kind of information, because that's what they do day in and day out. So,
okay.
But you could just direct them to my attention.
Okay, I'll do that. Thank you. I appreciate it. Nothing further, Mr. Chair.
Thank you. We appreciate your being here, Kristen. Thanks for the work.
Merry Christmas.
Merry Christmas indeed. And now veterans. Phil, thanks so much for being patient with us.
Thank you. You learned a lot. For those of you who don't know me, I'm Phil McCaskey. I'm your County Veterans Service Officer. This is the semi-annual report for the Veterans Affairs Office from July 1st to the current date. The office has had 192 scheduled visits and 30 walk-in visits, and over 500 phone calls pertaining to various questions that people are seeking answers to. Out of those 222 visits, we've generated over 521 forms, 60 being compensation and pension claims, 25 being death pension claims, and over 30 market applications for deceased veterans. And 160 POAs. The power of attorney forms are limited power of attorney, basically allows access to myself into the VA system through a limited power of attorney, and we work very closely with the American Legion, who I am accredited through along with the VA. So we use pretty much American Legion as our power of attorney in our office. Simply that the reason that is because the other organizations, they're all bound by a national charter of their own. They have different rules. They want different things, and it's just, I don't need that accreditation from all those organizations to do what we do on a daily basis there. And because I came from the American Legion, it's easy to get the accreditations. Also, we have provided 27 rides in to veterans during this period on our DAV shuttle van. We have a shuttle van that's given to the Jackson County through the grant program through the DAV and the Ann Arbor VA Medical Center. What that does, provides veterans a chance to ride to a scheduled appointment at the VA, only the VA in Ann Arbor. We don't shuttle them to the clinics or anywhere else. There's some restrictions that the VA puts forth on that, which is you can't ride if you're on oxygen. You can't be in a wheelchair. So it's pretty much self-ambulation to get there, and that van's driven by volunteers that have been screened through the VA from Jackson here, who've been physical, so they're actually volunteers. So they control the program. All we do in our office is take the requests and line up the drivers. And we provide services Monday through Thursday. We do not provide rides on Fridays. At one time when I first took over, we had 7 van drivers. Due to COVID and due to, seems like the volunteers are all our aged veterans. We're down to 3. And I just got notice before I came over here that one of my van drivers fell down the steps and he's in a Henry Ford Allegiance. So not a good thing. So we're down to 2 drivers. So we're working diligently with Ann Arbor to get these people who want to volunteer, but most of the volunteers want to go to Florida in the winter, which I don't blame them. So it kind of puts us in a pickle during the winter months, but we'll work through it. I can't drive the van. You have to be approved through the VA. You have to go through their whole approval process through the VA because they fund it. So that's where we're at on the van. I don't know if you guys are aware, we have the van. It's parked out at Shannon Road at the jail. So our drivers go out there every day and we pick up every morning when there is a ride either at the bus station downtown or out there at the jail. We don't pick up at people's homes. It's not allowed in the provision. Yes.
If you're looking for more drivers, do you guys have a little graphic that we could put up on social media to say, hey, listen, these guys are looking for drivers, or don't you want to do that?
Well, the problem is, it'd be nice, we use a lot of word of mouth and, within that veteran community, it just, like anything. I mean, I've been involved in a lot of public things in my community. Volunteers, people don't really volunteer a lot. You have to ask, and they very seldom will they tell you no to your face. So that's kind of what I've implemented with my drivers. Hey, if you know of someone, but we actually had one of our drivers recommend 2 people, and I can't get them through the Ann Arbor VA employee health to get physical. So COVID really put a monkey wrench in there because they weren't doing them. They don't communicate back with us. This guy says, hey, I haven't heard nothing. Well, when I do inquire, well, it's up to employee health. Well, employee health is untouchable. I don't have a resource to call, so I usually have to shuttle over there and drive over there and knock on doors. So, and Friday, they've closed the VA to the public again. So now Ann Arbor VA has been closed. They threw the service officers, everyone has to leave that's non-essential staff, and if you don't have an appointment, you're not coming in. So it's an intricate, the feds do what the feds do, so it's kind of tough dealing with what we deal with. And we've seen now most of the appointments are all telehealth. I'm not in favor of telehealth because I don't think that's a good thing. And a lot of the veterans don't like it either, and they don't have the skills or the computer access to do it. So we got some challenges in front of us, which are no fault of ours. We're working with what we have.
I guess we're looking for whatever, if you have suggestions that we can help you with, let us know to try and get your.
It's a problem, and a lot of the service organizations who have the clout within that realm, they're really working hard, but their people are the ones who were thrown out. Basically told them until we let you know you're not allowed back in because of COVID restrictions. So it's not a good thing. Now the numbers are back up, so they just exercised it and went on their merry way, and so we don't really know what's going to happen, but we've seen an influx of appointments just being canceled. Also, our office is currently partnered with the American Legion Department of Michigan, providing accredited service officers 2 days a week and assisting with claims within our office. Without them, we've always done, in the past, we've had the Vietnam Veterans of America, the Military Order Purple Heart, and the Marine Corps League, and the American Legion always come out and do service work in our office. The Military Purple Heart has closed their national office, so they don't have service officers in the state of Michigan. The Marine Corps League has totally shut down their service department. We don't have them. So, and the Vietnam Veterans of America, their charter to cover their grant funding through the Michigan Veterans Affairs Agency has moved out to the west side of the state, and they don't come to our area at all. So the American Legions who I have, and believe me, at one time I had 3 of them coming in because they couldn't get into hospitals, and I had some space that we could use, and I allowed them to use space, which got us extra time with service officer hours to get in there and do the work, but it also allowed them to be in compliance with their grant funding through the state of Michigan. So it's been It's been a weird ride when it comes to this grant funding through the Michigan Veterans Affairs. It doesn't affect us, but it does affect our partners in the American Legion and the other service organizations. We're also we've partnered with the Dearborn Vet Center. They provide mental health counseling to veterans of our county. She currently is seeing around 7 vets currently. We currently are involved with the Ann Arbor VA in a pilot program for suicide prevention that is in the infant stages of development here in the Jackson County area. So we had one meeting. They're looking for stakeholders, which I've told them I'd rather be that support staff. I don't have, with the caseload we have there, just not something I want to take on, but I'll be there to support them in any effort they have here and within the county. We also, on last Thursday, I met with the branch manager of Mortgage One, Michael Archer, talking about partnering with them a little bit on VA home loans. That's a benefit that every veteran earns, every honorable veteran earns to be able to use, but VA doesn't put out a lot of information. Our job in our office is strictly to help fill out the form for the home loan certificate and mail it to Cleveland for them. They do a lot. He's a veteran himself, so he does a lot of VA home loans, and he reached out to us if I'd take time to listen to him. I'm not going to be the one to say, oh yeah, you need to go to Mortgage One, but they do a lot of that work, and they're on the other side of it where what's required, a home inspection. Because out there in that real estate market, there's a lot of people out there that got their hands on everything, and they do a good job of, you don't need a home loan or inspection, you don't need this, you don't need that, and so there's a lot of myths out there that you just can't get answered from VA. So I'm looking forward to it. We even talked about possibly hosting a veteran town hall strictly about home loans. Because right now you can refinance your current home, and it doesn't have to be on a VA home loan. You can refi. If you've bought one and paid it off, you can, there's a lot of, they really open up the dynamics, but people don't know. They don't know what they don't know. So I'm looking forward to help with that. And we also constantly work with the Community Action Agency for helping with placement, any information they need for helping our homeless veterans within the county. If they need information on a veteran or they need something about what their monthly status is, we can most generally get them over here. If I don't have access, I can get that veteran over to our office, get the access so I can provide them, so we can get them off the street or out of the woods or wherever they're at. So really, really, really work hard with them, and those people do a lot. We had just recently, a bus driver called me and said, hey, I have a veteran that just took up a home over here by East Myers, living in one of their bus shelters, just took it over. So I asked Community Action Agency to go out there and reach out to them. So I got a report back that they went out and they've got this guy got him in the shelter, and so getting him some home, get him off the street. So that's a good thing. Networking 101, basically. We also work with the Veterans Affairs Agency produces, I skipped, sorry. The Veterans Affairs Agency produces an annual geographic distribution of VA expenditures, basically what we call the GDX. That's kind of what we go by when the VA is auditing what they've spent towards veterans. So in their report, which is 2020, the 2021 doesn't come out till May. So we'll have that ongoing every year. But I'd like to share some numbers with you that are very interesting to me, and it kind of gives you an idea where you stand. According to the VA, there are 567,919 veterans in the state of Michigan. In the state of Michigan, 10,472 veterans are right here in Jackson County. The VA reported that there was $87 million was reported as an expenditure to those veterans. And I'd like to break a little bit of that down, a couple of the big topics here. $44 million was in VA compensation and pension payments to veterans. The other thing was $39 million in medical care costs for those veterans. These are the two largest categories. The $44 million is actual dollars being paid to veterans, which potentially is being spent right here within the county. This is money going to the veterans that they ultimately pay their house payments and buy groceries. So it's a huge amount of money. Where we rank within these counties, there's 83 counties in the state, as we all know. Jackson ranks 14th in veteran population. We rank 12th in total expenditures, 14th in comp and pen payments paid out, and 10th in medical care facilities. And I think a lot of that's got to do with the fact that we have a clinic right here in Jackson County that all veterans come to, but it gives people in this county more services really because they're right here. People who live in the southern Hillsdale County, a lot of those people are going to Indiana because they're closer in geographical location, so it doesn't involved in the numbers. And we also rank 15th in vocational rehab, which is retraining for veterans who can't do the work they do because of disability. They can be vocationally retrained to do a different kind of work. So we rank up there quite high. I mean, Jackson's always been a steadfast within, we have a lot of veterans for a county our size, and we have a lot of veterans organizations within the county, which kind of is good because of the fact that I just got wind last night at a Fraternal Order Eagles district meeting that one of our fraternal organizations, the Eagles of Michigan Center, just donated $15,000 or $13,000 to the Vietnam Veterans chapter here in Jackson for one of their programs they're doing. That's something that doesn't involve my office, but they're working totally, in the county, and that's a great thing to see as a veteran service director. I don't get involved in it because they don't ask me to be involved in it, but they do a lot. There's a lot of things happening within Jackson County and Veterans Affairs, which kind of makes my job easy. We also have the Veterans Coalition, and that's Dave Lillahan's leading that right now, and that's always been kind of his deal, and they deal with the parades and Memorial Day, and we provide the flags with the graciousness of budget through the commissioners. Any questions you may have on some? I know I threw numbers at you, but this is off the holy grail of the GDX.
No questions? Okay.
Okay.
One thing I want to add. I'm hoping,
okay,
Phil, that you'll send your report to us. If you can get it to us,
yep,
and the administration will distribute it to commissioners, and then next time we'll have that report in advance, right? Okay.
I got skipped on this. I looked at the schedule. I never even seen it where I was at, but that was my fault probably more than anybody else's. Well, I want to just say one thing before I close. Sure. I want to thanks to County Administrator Mike Overton and the Board of Commissioners for allowing me to serve the veterans of Jackson County, because without the advocacy that we provide in our office, these veterans would not be able to have the advocacy to win a case, because VA says anybody can file a claim, but to file something that can be truly adjudicated and won is huge. And without that, they earned the right. They served our nation. They should be given that. So I want to thank all of you. Thank you.
Thank you, Phil. Appreciate you being here. Next up is the claims. Chair will entertain a motion to pay the claims.
Motion to pay the claims.
Thank you, Commissioner Williams. Thank you, Commissioner Bear. Any questions on the claims? All in favor will please say aye. Aye. Any opposed? Thank you. Please take note of the minutes of the DHHS board that are part of your board packet. We'll note the reporting schedule is for January, Department on Aging, the Health Department, and Lifeways. We are up to public comment. Is there any public comment? Any public comment? Public comment is now closed. Any committee member comments? Thank you for being here. Thank you for hanging in, members, so that we had a quorum for doing our remaining business. Without further ado, declare the committee adjourned until call of the chair. Thank you.